Our next speaker is Eshan Vishwakarma. Okay, I did it correctly. Do you want to talk it there or talk up there? Okay. Yeah, because I met you through Dr. Diller as well. Did I? No, yes, okay, couldn't remember. He's got some interesting things he's gonna talk about and what he's doing and what CNCF is doing with him. Eshan.
I just want to start by saying that I also had a killer college essay for my neuroblastoma. And I also did my Make-A-Wish to Disney as well. So that's really funny. But my name is Eshan. I'm a rising senior at Harvard University and a stage 3 neuroblastoma survivor. I am really excited to talk about my cancer journey, survivorship, and a really cool initiative I've been working on for the past year, which is a startup for cancer survivors as well. So I'd like to start at the beginning. When I was 4 years old in July 2008, I began experiencing frequent low-grade fevers. My pediatrician, as many would, initially attributed many of these symptoms to common childhood illnesses such as strep or viral infections. However, during one particular clinic visit, a different doctor recognized that there was something deeper at play, and that kind of started this diagnosis, which happened on July 2nd, 2008. My initial treatment course began in my hometown, VCU Hospital, Richmond, Virginia. However, the proposed treatment protocol which I was on, which was a Children's Oncology Group treatment protocol, included a high-risk tumor removal, a surgery, and a double stem cell transplant, which led my parents to seek specialized care. And my mom in the audience put a lot of hours in finding options. After thorough research, we connected with Dr. Modak at Memorial Sloan Kettering Cancer Center in New York City. In December 2008, I underwent surgery performed by Dr. LaQualia, a skilled Sloan Kettering surgeon, and on December 18, 2008, no residual tumor was found in my resected left adrenal gland. And this was a big step for myself and for my family. Following the surgery, my treatment continued with 2 more cycles of chemotherapy, radiation, 6 cycles of the 3F8 antibody treatment, and this was all overseen by a dedicated MSK neuroblastoma team, including Dr. Modak, Dr. Chang. I'm grateful to say that I've been in remission since 2009. However, as a survivor, my journey didn't end with remission. I continued to receive long-term follow-up appointments at Sloan Kettering. They monitor my heart, my cardiovascular health, my pulmonary functions. We track long-term impacts such as high-frequency hearing loss. And in high school, I also underwent multiple surgeries for hip dysplasia, which the connection remains uncertain, but it just kind of, it highlights the complex ongoing nature of survivorship. As an undergrad at Harvard, I've had the privilege of being at the forefront of advancements in technology and startups and medicine, and being a cancer survivor myself. I have always had a unique vantage point where what if we could harness the power of technology and artificial intelligence to improve survivorship care, even in a tiny way? I like to imagine a future where we could have kind of agentic models that could coordinate all survivorship appointments on the behalf of our patients, proactively understand what you would need before you need to even ask based on your medical records, and it can help you get access to physicians and automatically schedule you in without having to deal with that burden yourself or having your parents have to deal with that. And this is a lot of what we're building at Pathway Oncology, and I'd like to show a quick video, a promotional video of what we're building just to highlight kind of a little bit of what I'm so excited to be working on.
Healthcare is broken for cancer survivors. I'm Jace, this is Eshan. We're both young adult cancer survivors, and we're fed up with the lack of real support after treatment. Even the good resources, they're falling short. That's why we built Pathway, a next-gen platform for survivorship care powered by AI. We're combining the latest in longevity medicine with truly personalized healing. We analyze your biomarker. Welcome to the future of healthcare. Welcome to Pathway.
Oh, thank you. Really, the goal is simple. I mean, it's quite ambitious, but what we see is with increasing incidence of cancer and increasing efficacy of treatment, more people are expected to survive cancer in the future. However, what we see is survivorship care is still something that needs a constant advancement, like Dr. Diller mentioned. Survivors face numerous medical costs and significant burdens even years after completion of treatment, and the system can be quite fragmented at times the further out you get. We see that survivors face elevated risks of cardiac disease, infertility, cancer recurrence at times, and mental illness, and navigating these challenges without support can be quite difficult for not only the survivor but the family as a whole. And so what we've been working on for the past year is building an ecosystem of tools built using artificial intelligence and a lot of technology that allows survivors to really heal and access the digital health platform that aids in their healing. Our mission is clear. It's really to build infrastructure around life after cancer, something that follows a patient seamlessly in the background for the rest of their life. So 10 years, decades down the line, they can have this platform in a similar way that you have a Netflix subscription. We're starting with the 2.6 million childhood and adolescent young adult cancer survivors in the US today, and hoping to expand from that point onwards. One of the first platforms that we're working on directly addresses something that I've always wanted, which is a virtual survivorship and longevity clinic that layers on top of in-person survivorship care. Something that whenever a new symptom appears or something that I'm stressed out about, I can quickly flag it and access a platform and have my questions answered really easily. It's longitudinal, risk stratified, and rigorously grounded in science, and we're working with a bunch of oncologists, nutritionists, dietitians, and therapists to bring one platform and to become one platform such as a medical home for many of these cancer survivors. And beyond clinical care, we're also building Pathway Connect, which is a free social and educational hub, really hoping to enable survivors to start taking control over their healthcare, understanding their latent side effects, and connect with other survivors of similar backgrounds, empowering individuals with knowledge and really allowing them to also access a concierge service over text messages that can help them understand kind of what is the local specialist, where can I find an audiologist, a cardiologist, and we take it a step further where we autonomously coordinate services for them, booking them in to an audiologist or a cardiologist on their behalf. But really, all of this comes back to a core premise of what I've experienced firsthand in my journey, and I've seen many peers and friends struggle with survivorship care, especially childhood cancer survivors that I've grown up with. It's a quite profound problem, and it's a problem which I believe technology can work at least 1% towards solving. And one of our earliest adopters kind of shares this the best way.
My name is Savannah Anshaw. I'm 19, and I was diagnosed with ALL when I was 8 years old. I had to go through total body radiation. Years after, I had to use a wheelchair to get around because I was super weak. Learned that I had a blood disorder when I was 12. I'm diabetic as well from the pancreatitis suffered in the PICU. You get the initial suffering of the disease itself, and then everything comes after. Like, hitting hard is the loss of friends along the way, and then that survivor's guilt. The medical records and keeping track of everything, especially transitioning into an adult from having to get new doctors. It was a whole big ordeal, and being able to have a platform that can connect you with others, not only that, but hold all of your information, get you set up with a specialist, and do all of this amazing stuff is just beyond me.
Does anyone have any questions for Eshan? Frank?
When are you going to have your IPO? I'd like to be the first.
We're still a very long way away from it, but hopefully.
When do you project having this up?
Yeah, so the Connect platform is launching at the end of the month. So it's going to be available to caregivers, patients, survivors, and then right now we're raising funding to build the full telemedicine platform. And so the hope is within the next 3 to 4 months, we'll have kind of the initial beta version of the telemedicine platform available for people to start signing up.
It's a brilliant idea.
Thank you.
It's brilliant. Thank you for doing that.
Yeah, it's a very personal thing. I think it's something that I've really noticed that many survivors, especially childhood cancer survivors, struggle with 10 years down the line, 15 years down the line when they're looking for resources, and it's a little bit harder to get back into your original oncology center.
Yeah, it's very perceptive of you to, yeah. Well, obviously you're experiencing it.
Yeah.
I have a 36-year-old daughter, and it's been difficult to get. A brilliant idea.
Yeah.
Thank you. Thank you. Thank you.
Okay, another?
I just have a quick question. So when you look to find, I think one of the hardest things, and Emily mentioned it, is that kids who are 20 years old now, right, and they've been away for treatment, just like you and Emily are the same age.
Yep.
And I'm sure that you feel isolated sometimes socially, right, because there's not a lot of kids who have had neuroblastoma. So I think you're brilliant. There's a reason you're at Harvard. How do you find those people to get into the system, right? Because they're everywhere, and a lot of survivors don't follow up with care for whatever reason.
Yeah.
So when you look at people, you, Emily, and the thousands of other neuroblastoma survivors, how do you intend, or what's the plan, or how are you going to get them into the system so that the social aspect, community aspect is robust?
Yeah, no, that's a great question, and we've talked really thoroughly about that. Where we excel as opposed to academic centers is that we use a very social media driven approach. So my co-founder, who you heard the voiceover in that video, Jace Yannick, he has a platform of over 1 million cancer survivors and cancer patients, and we're partnering with influencers to really make it so that this is something that is no longer a touchy subject to talk about. I think survivorship care, even when you're 10 years down the line, 15 years down the line, it can feel kind of burdensome to return to survivorship care because, I mean, I can speak from my personal experience. It's sometimes like I feel like I'm taking resources from someone who could use it better. Like I'm taking physician time, and like usually for all intents and purposes, I feel healthy as a 20-year-old, but I know biologically there are things that I should really be cognizant of and I should be watching out for. So I think it's really flipping the script in terms of how we do the marketing and the messaging of what we're building. A lot of it is focused on proactive care and looking ahead. So one of the things that we're really working on is longevity medicine. How do we think about your 50s and 60s, and what can we implement today that helps you extend your lifespan and age better? And I think that really helps us engage those survivors which are 10 years down the line, 15 years down the line, given that we are still talking about kind of survivorship and your cancer diagnosis, but so much of what we're working on is how do we look ahead and help you kind of optimize your health for your future? And I think that really engages a lot of the early folks that we've been working with, and it engages me as well. So.
That was so great. I just want to point out that, people like myself are, we're not as savvy with all the stuff that you are doing. And it's so great to have new, new energy from a youth that was raised on social media, from it's a generational change in how you communicate, how you get information, how you process information. Now we recognize how you get information from a medical record, how you get medical care even. It's just generationally so different than the way I was trained, the way I've lived my life, the way my colleagues in pediatric oncology are. So it's great, for us to be open to this. And, we've had conversations about this, and I've met the CMO, and I just think it's great to think of new paradigms and to have those paradigms be informed by some people who have, kind of the newer ways of thinking about the way they interact with each other and with the medical community. So bravo.
Yeah.
Thank you.
Thank you. And are you sure you're 20 years old? There's something about you.
21.
Okay, sorry, you're so old. It's wonderful. You and Emily, again, give so much hope. And if we could give them a round of applause for what they did.